More vaccinated residents and the opening of inter-island travel have led to a big drop in the number of people showing up for COVID tests. And that lack of testing is leaving millions of dollars in federal funding unspent. Gina Mangieri is always investigating.
A series of relief packages poured billions in federal money into our state. And Always Investigating has learned that a lot of that cash meant for COVID testing programs has yet to be tapped. As many as 5,000 to 7,000 COVID tests a day was common in Hawaii in recent months, but this week saw just 3,300 daily tests logged, the lowest weekday count since New Year's Day.
There were some stats we were seeing that upwards of 75% of all the tests that were being done on Oahu were being due to inter-island traveling or mainland traveling or required by employment.
On Monday, demand for testing dropped as inter-island travel reopened without restrictions Tuesday, and vaccinated residents returning from the mainland also no longer need a test. Why is testing still important with more than half the population fully vaccinated?
We know at least 40 to 50% of individuals are asymptomatic positive. So how are those individuals going to know whether they have the disease or not? So that's why you still need to have a large amount of surveillance testing available while you're pushing your vaccine rates up at the same time.
This week, the Delta variant behind the outbreak in India popped up in Hawaii as a mild case of COVID in a fully vaccinated local traveler. Yet, as test volume declines,
it's likely the positivity numbers that we have are not truly reflective of the actual count of disease in our state because we do not have the allocation of testing to the areas that we need to focus.
It's not for lack of resources. The feds gave Hawaii more than $170 million just for testing, and the latest accounting shows most of that is unspent. I asked the State Department of Health, what's the plan?
Community testing is going to remain important too, especially for any congregate setting. So places where people are living together, such as nursing homes, for incarcerated persons. There's going to be settings where testing remains very important to keep a finger on the pulse of whether COVID is circulating. One place where testing will continue no matter what is going to be in medical offices, emergency rooms, hospitals.
Right now, there's no shortage of supplies of the test kits, which often cost consumers $100 a pop.
I do a periodic survey of the private sector laboratories, and they report their inventory of test kits on hand. And there seems to be a robust supply of test kits on hand. I'm not concerned about that.
A huge chunk of the unspent federal money for testing, more than $40 million, was slated just for schools.
Schools are one of them, where we have populations that are not eligible for vaccination. So we are working to expand some school testing pilots that have started over the summer and looking to ramp those up in the fall.
Other states and school districts already have widespread testing either underway or have issued bids for the coming school year. The state and DOE procurement websites show no active solicitations for COVID testing at schools or elsewhere. Hawaii summer school students and staff who opted in can access tests at 18 Oahu public schools. 14 schools are doing weekly in-school testing, and 4 schools are giving vouchers to get tested at CVS. It runs only through July, and not all schools on the pilot program list have even started yet. Some start later this week. On top of big program rollouts, just finding thousands more people willing to get tested to replace the travel-related testing exodus remains as important as ever.
I think that the variants are a constant concern for those of us in public health because it's our job to worry about what might be around the corner.
Gina Mangieri, KHON2 News, Always Investigating.